Hi, everyone. My name is Adrienne Burnest, and I am the Education and Community Liaison at the Nanaimo Brain Injury Society. Today, we are with Jan McNeill. She is a clinical counselor from Covalent Health Consulting, and she is going to talk to us today about depression and acquired brain injury. So welcome, Jan.
Thanks. Yeah, thank you for having me and allowing me to do this. It's great. So just so that you know who I am, I actually used to work at GS Strong, which is over in Vancouver, and it's the provincial, both for BC and for Yukon actually, for the brain injuries, acquired brain injuries, traumatic brain injuries. We also worked with spinal cord injuries, and I was a counselor there for a little while and moved over to Nanaimo and got to know Adrienne. And I feel very lucky.
Lucky to have you. Thank you for joining us this morning.
No problem. So we're just going to do today, we're going to do a little bit on brain injury and depression, because sometimes they often go hand in hand. And so I'll just start getting into the presentation, if that's okay. Cool. Okay. So brain injuries and mental health. People don't realize, but one of the many factors that can be affected by a brain injury is mental health. So 1 in 5 may experience mental health issues either 6 months after a traumatic brain injury or sometimes even sooner. And you may be asking, well, what is mental health? Although there's been lots of conversations in the media right now because of the pandemic and everything around mental health, but basically it's our mood, how we're able to cope with our emotions, which is kind of emotion regulation, and then our behaviors. So our behavior is based on how we're feeling. And one thing that's interesting is actually mental health issues can sometimes make brain injuries worse. And I remember reading that thinking, oh, that's interesting, because brain injuries can bring on mental health. But if you have a mental health issue and then you have a brain injury, it can actually sort of magnify the impact of that mental health issue. So this is kind of a nice slide. I thought you can have mental health disorders and then you can have a brain injury, but then you also can have that overlap in that space. And so people with brain injuries can suffer from major depression, can have post-traumatic stress, and they can also have generalized anxiety. Okay, so as I mentioned, some can develop basically depression within very short time, so within months of their injury. For others, it can actually not be for years later. And so in some research studies, they've actually said up to 60% of people with a traumatic brain injury can develop depression soon after the injury or later. And then as small as 20%. So that's the, it can be 1 in 10, up to 6 in 10 can develop a depression, which can be kind of big if you think about it. So what are some of the reasons for this? Well, brain wiring is impacted by the injury. So depending on where the brain injury is in your head, it can be more or less impacted. So you can have a bigger impact in terms of the mental health, or you can have a smaller impact. And so in the brain, we actually have a whole bunch of neurotransmitters and hormones. And these are essential for how we regulate our mood, okay? And so the ones that really tend to be the ones that, the neurotransmitters that have the most impact, serotonin, epinephrine, dopamine, norepinephrine, and acetylcholine. And so I thought this was kind of a nice image where you can see all the brain being used and lots of different parts of the brain being used when we have no depression. You can see you have access to all different parts of the brain. Whereas when we are depressed, we actually use less of the brain. The other parts of the brain kind of shut off. And so we have less access to it. Okay. So some of the other challenges is that psychological impact. So you've actually lost function in areas that potentially you used to feel really good about or found really easy. And now after a brain injury, you have trouble with it. You think, well, I didn't used to have trouble with this. And so then that can end up feeling not so good. You can also find that you have troubles with everyday issues where you didn't used to have trouble with everyday issues. So when you start to compare your before state to what you're going through right now, and that it takes so much more effort to do things sometimes, and that you get so much more tired more quickly, it can feel really depressing. It can feel really overwhelming. Especially when you get so tired so easily. And understanding that part of rest is so important when it comes to healing with the brain. Okay. So what are some common signs? So some of the signs and symptoms of depression following a brain injury are you kind of feeling low, sad, or hopeless consistently over a couple of weeks. There isn't kind of a break. You're not kind of interested in doing any kind of activities that you used to find pleasure in. Or even when you do something, you don't really get a whole lot of pleasure or joy from it. You can kind of feel guilty about things, or you can feel like there's a failure because you can't do things the way you used to, or you want to try and do something and you can't, or you forget about it. And so you end up beating yourself up all the time. So you have a lot of guilt around how you could do things before and now you can't. Or you plan on doing things, but you don't get to doing them. And so all of those feelings of worthlessness or bad feelings about yourself end up really starting to sort of take over. You can also find that you end up sleeping too much or not sleeping enough. And you can also find that your appetite can change. So you want to eat all the time, or you don't have an appetite at all. And sometimes you can find yourself wanting to withdraw socially. So you don't want to go and see friends. You don't want to spend time with the family because when you get so overwhelmed with all of the chaos and the stimulation around you, you find it just too much. And so you'd rather be on your own because it's just easier. It's not as overwhelming. You can find that you kind of just lethargic. Don't really feel like doing anything. You can have thoughts of wanting to hurt yourself, or you can have thoughts of dying. And then you can have really hard time concentrating. So you are focusing on one thing and then you get distracted and focus on something else, or you focus on something and then you forget what you were wanting to go and do, what you're trying to focus on. And all of those things can lead to you not feeling good about yourself. And it can lead to feelings of really being negative and depression. So I love Peanuts cartoon. And oftentimes when you're feeling depressed, you kind of slump over and you don't have much energy. So Charlie Brown says, "This is my depressed stance." When you're depressed, it makes a lot of difference how you stand. The worst thing you can do is straighten up and hold your head high, because then you'll start to feel better. If you're going to get any joy out of being depressed, you've got to stand like this. So that's Charlie Brown. Okay. So in order to understand how important it is and how normal it is to experience depression after a brain injury, I thought we'd watch this little video. It's not very long, but it's just a little bit. So here, I'm just going to press start.
So depression is another common complication after a brain injury. It's the most common mood disorder that occurs after brain injury. And so it really, for rehab physicians and other caregivers and healthcare practitioners dealing with people who've had brain injury, it's a good idea to keep this in mind because depression, whether it's in the setting of brain injury or not, can have an important effect on cognition, And that obviously has implications for how people recover after their injury. Neurotransmitters are an important component of all elements of brain functioning, including we think, the development of post-traumatic depression. And so we are seeing some genetic susceptibility markers involving neurotransmitter systems that have previously been implicated in depression, and also in other types of brain chemicals called neurotrophins, and the ability that neurotrophins might have to help resist the development of depression after brain injury. And what we find very intriguing about the neurotrophin connection to depression is that neurotrophins can be very easily manipulated by your environment and activity. So exercise is a potent stimulator of neurotrophins. And so as a rehab physician, looking at chemicals that can be impacted by activity, by exercise, are very encouraging for us, because we would hope to be able to identify treatment strategies that might actually manipulate the physiology in a positive way to help either prevent the development or at least lessen the severity of depression that people do go through often after their injury.
Okay, now I know you're all thinking, exercise. And we'll get to that again. But that was kind of a nice summary of what we talked about already in terms of some of those neurotransmitters and neurotrophins. Okay, so it's important to remember that depression is not a sign of weakness, just as you heard from another professional, that it's quite common. It's actually the most common illness to have after a brain injury. It's not anyone's fault. And a person cannot get over depression just by simply wishing it away or using more willpower or toughening it up. So it's important to have some compassion towards yourself and some understanding that if you are experiencing some depression after a brain injury, or if a loved one is experiencing depression after an brain injury, it's important for them to get some support and some help, and to recognize that there are ways of helping to alleviate some of these symptoms. Okay, so what can be done? Antidepressant medications have actually been shown to be very helpful, especially if you combine it with some counseling, right?
Yeah.
Yeah.
Sorry to interrupt. I'm just, the screen on my end is frozen.
Oh, okay. So I'm keep on going. Mine isn't. So I'm curious about that.
We've been having some technical difficulties this morning, but
if I go back now, I've gone back a couple of slides. Is it still
I'm
going?
frozen on the video.
On the video?
Yeah.
Okay. Now is it switched?
No.
Okay, let's see what I can do here. Okay. Can you see me changing my screen?
Yes.
Okay. So now are you on a different screen?
I am.
Okay, look. All right, thanks.
Look at us. All right. Depression is not a sign of weakness. That's what I'm on.
Perfect.
Perfect. Continue. Thank you.
Thanks for letting me know. Otherwise, I would have gone the whole thing. So I appreciate that.
There we go.
Yeah. So everything's an opportunity to learn, and everything's an opportunity to grow. And so Adrian just helped me do that. So as I was saying before, depression isn't a sign of weakness, okay? And it's not anyone's fault. And we can't get over it just by trying to toughen up, okay? And then medications can be really helpful in terms of giving yourself a little bit of a boost and help with those neurotransmitters in the brain to help you to stabilize a little bit. but it also helps to see a professional so that you can develop some skills and tools to manage some of this stuff. And exercise is always important. Just as you heard from that other physician, that exercise actually helps to produce some of those healing chemicals in the brain, okay? So support, exercise, and talking about it are really important strategies to minimize the impact, okay, of the depression. So medications help to reduce depression and anxiety are often the first step in treating some severe emotional disturbance like depression or anxiety. They're often used in combination. Some people like to do the counseling first and try to do exercise and try to change the way they think. And if that doesn't work, then go on medication. Sometimes people, because they're so depressed, need the medication to support the other stuff in terms of the therapy and the exercise, because you don't have the energy to do the exercise or to go for counseling because you may be so depressed. And so that's where the medications can help give you that little boost to start feeling a bit more motivated. When we start these meds, it's often a very low dose, and so you may not notice anything, but we increase it slowly just so that we can monitor any kind of reactions that you might have, whether it's helpful or not helpful, okay? And again, here we go. Aerobic exercise and structured activities during each day can sometimes help depression. So if you have something on a regular basis that you have to just get up and go and do, it can be really helpful to combat depression. And here's our little brain doing exercise. Okay. So the first steps to healing, we have to acknowledge that we're not doing so great. Acknowledge that, you know, you're having a hard time getting out of bed, or you've got all these negative thoughts in your mind. And it'd be helpful to talk to a professional, either a counselor or your doctor, or even Adrian, someone at the Brain Injury Society can be helpful. And it's really important to try and get treatment early, because we don't want you to suffer when you don't have to. It doesn't feel good to be depressed and have all those negative thoughts. So don't wait. So what are some strategies to cope with depression after traumatic brain injury? Again, talking to someone. Let them know how you're feeling. And if it's hard to talk, maybe write a letter to them to let them know how you're feeling. So a loved one or a friend, and maybe they can start to try and get you some support. Try not to isolate. Remember how we were talking about that social withdrawal is one of the symptoms? We know it's hard, especially right now, but try to spend some time with people you care about, even through Zoom. Zoom's a great way to connect. Perfect example, us doing this right now, without actually having to leave your home if that gets overwhelming to try and leave. Okay, do something you like to do. Let's just listen to some music if that's helpful. Start to create some art. Maybe do some drawings, maybe get some paint, or maybe even doing some reading. So sometimes reading can be helpful. And I know it can be hard sometimes to sort of take in that information. But sometimes reading something quick and simple over and over and over again can actually be helpful. Again, and here we go, exercise. Exercise, it just keeps on coming up. I'm telling you, it's so important, exercise, to have on a daily basis, because it really has shown to have a huge impact on how you feel throughout the day. Sometimes people like to go out and do volunteering. Some people like to get into spiritual activities or self-help groups. And I know the Nanaimo Brain Injury has some groups that they facilitate as well. They also have peer-to-peer, so one-on-one that you can do Zoom. Okay. So I'm prescribing you exercise. Think of it as a stress pill that takes 30 minutes to swallow. So if you can do exercise for 30 minutes, that's great. I like to start with 20 minutes. So maybe going for a walk for 10 minutes and then turn around and come back for 10. And that kind of seems a bit more doable. So we're not wanting you to have this huge exercise for 30 minutes, go out and then exhaust yourself. We're just going to start slowly and build up because we want you to have success. So maybe if it just means going out for 5 minutes out of your house, walk out for 5 minutes, turn around, walk back for 5 minutes. Maybe you do that 2, 3, 4 times a week in the first week. Then the next week you do, okay, I did 10 minutes a day. Now I can try doing 10 minutes out and then 10 minutes back. We really want this to be something that's gradual and not so overwhelming that you're not going to want to do it. Okay, ask for help. It's okay to ask for help. It's really important to ask for help. Okay. Okay. Something that some clients like to do is have a soothing box. And so a box that helps them to make themselves feel a little bit better. So in this one, you can see that red happy face, and that's kind of a squeezy ball. Some people like to do that. Squeeze the ball. There's some cards. It says today's cards or today's gift, something to read, make yourself feel better. A stuffy can help make you feel better. I put in some bubbles because actually it feels pretty good to just sit and blow bubbles. You have to breathe in, and then as you breathe out, and then it's kind of nice to see the bubbles. And so you can create your own sort of soothing box. Put things that make you feel good in it. Okay? And breathing. So breathing is the only thing in your body that helps to control both of your nervous systems. So when we start taking control of our breath, we're actually taking control kind of our mind and our body. And so, yeah, I already breathe. However, there are certain things that can help breathing. And what does it actually do for you? Well, it helps to calm the nervous system, and it helps you to become more aware mentally, less reactive, right? So it impacts you physically, emotionally, and psychologically. Who would have thought? Okay. So we want to learn how to breathe. Now, do you see how she's got one hand on her chest and one hand on her belly? So when we breathe, we want the belly to move, okay? I don't know if you can see my hand on my belly. So we want the belly to move out when you breathe in and not the hand on your chest, okay? So we're just going to try this for a moment. Breathing in through your nose and push the belly out. And you'll notice my hand on my chest didn't move. So if you find this difficult to do, what can be really good is lying flat on the ground and then putting your cell phone or a book or something on your belly and basically trying to push that cell phone or that book up so it falls off your belly. And we just do that a little bit to get those muscles going, right? And then when you breathe in through your nose, and then push that book off or push that cell phone off as you breathe in, and then breathing out through your mouth. Okay? And that is actually helping to initiate the relaxation response, which we'll get to in a minute. But here we go. So the quieter you become, the more you can hear, says the Zen frog. So if you think of belly breathing, when you look at a baby and they're lying down, the first thing you see is their bellies go up and down. It's the same thing with dogs and cats. You'll see them, their bellies going up and down, up and down. So if you can think of it that way, that helps a little bit more. Okay. Another strategy to help with when you're feeling sort of crappy and depressed, we're going to look around and these going to use your 5 senses. So what do you see? So look around the room and name 5 things you see. And then if you get bored doing that, you can do colors. So what are 5 things that I see that are green, or blue, or brown? And then what do you feel? So texture-wise. So you can pick something up. So you can pick up a pillow. What does it feel like? Oh, it's soft. Or you can touch your shirt or your pants or a necklace. Does it feel hot? Does it feel cold? Is it smooth? Is it rough? What's the texture about it? Okay. And then what do you hear? What are some sounds? I can hear the air conditioner right now. I can hear my voice. I can hear a clock ticking in my office. What are some of the things, the sounds that you can hear? And if you can't hear anything, what might be your favorite sounds? So do you like to hear the sound of waves? Do you like to hear the sound of birds or a musical sound? And then what do you smell? So think of your favorite smell. Some people love to smell lavender. Some people love the smell of vanilla. Sometimes you can just smell the air. You know, when it's finished raining and you go outside and there's that sort of damp, wet smell in the trees. I love that smell. Or at Christmas and the pine tree smell. And then what do you taste? You know, that kind of mouth breath you can taste. Or what's your favorite thing to taste? Peppermint or chocolate, or some people even love the taste of lemons. Can't say I'm one of them, but that's okay. Some are. And so we want to use our senses. And after we've done that, we can do it a few times. It'll actually help us to think more clearly. Okay, what else have we got here? Oh, digging your heels in. So everybody takes a minute and just when you're sitting there, you can dig your heels in for a count of 3 and then release. Dig the heels in for a count of 3 and then release. And then dig your heels in for 3 and release. And then what do you notice? The body kind of settles, you feel a bit better, a bit more clear in your head. Or when you're walking, you can feel your heel walk and then your toe. Heel and then toe. And just noticing that, okay, as you're walking. This is another great one. You can push your palms together, okay? Hold for 3. And then do it again, hold for 3. Some people like to push their palms together like this, hold for 3. And do this as many times as you need to until you start feeling a bit better, okay? And that's basically what I've got. Hopefully that will have been some help. There's also here some resources. So if you're feeling depressed, the Vancouver Island Crisis Line is great, okay? They're there for you, easy to talk to, and they're looking forward to your call. They're literally sitting there waiting for someone to call. That's it, that's their job, waiting to hear from you. Sometimes I'll even get clients to actually phone them even when they don't need to, and just say, it was suggested by me or to me by a counselor for me just to phone in case I ever needed it. And that way you have an opportunity to phone them when you're not feeling at your worst. Here in Nanaimo, we have the Crisis Counseling Clinic where you can actually go in and see a counselor, or you can phone them and they can phone you back or do a Zoom call. I think they're still doing Zoom. That might be a suggestion. And then there's some links here. So that I've put in, and you can copy them down. Because I guess you really click on them, can you? On a video link. Didn't think of that. But it's something you can copy down, or you can look at msktc.org, and you'll see that they've got some emotional problems after traumatic brain injuries. The Mood Disorder Association of BC has some really good stuff. The Bounce Back program. And actually, what you're going to find in some of these, they have apps now, a lot of apps in these different. So the Mood Disorders of BC, the Bounce Back program, Canadian Mental Health Association, there's a lot of different apps that you can now use to help you when you're feeling not so great, okay? And then of course the suicide line. Okay, and then thank you. So if you have any questions, my contacts at the beginning, it's Covalent Health Consulting, and you're welcome to look us up on the web. And the reason we have covalent is because covalent bonds are when you have in science, we're all science nerds here. You have two electrons, and if they, at least two molecules, and if they share electrons, they actually become more stable, which is covalent. So our business name is a sharing of electrons to create stability. So, Covalent Health Consulting.
Thank you very much. That was very good. It's really nice to have some practical, useful tips and tricks for people. I know this time has been difficult for a lot of people in the brain injury community, and having to isolate and not being able to do the volunteering or the activities that they had in their life, and that gave them some structure. So these are some fantastic tips for kind of getting through some of that. Thank you so much for joining us this morning. Technical difficulties and all, we managed to get it all done, so that's great. Thanks everyone for joining us. We will see you on the next one, and if you need more information, visit us at www.mbis.ca. Thank you, Jan, and we'll see you next time.
Sounds great. Thanks.